Hello, friends. Welcome to Heidi's Colorful Colorado. I'm your host, Heidi Ganal, a wife, mom of four, CU Regent, and the founder of Camp Bow Wow and the She Factor. With a passion for keeping the spirit of our state alive and well, I started this podcast to bring the people of Colorado together to celebrate the amazing state we call home. Come along on this journey with me as I travel across our old country roads in my vintage RV, interviewing folks that embody the true spirit of the Rocky Mountains. From the Front Range to the Mile High City to the Wild West of Southern Colorado, we'll celebrate the history, beauty, and Coloradans that make this place the colorful state it is. Each week, you'll meet people trailblazing the way for an even more colorful future for us all, making a huge difference along the way. Are you ready for a Rocky Mountain ride? Let's do this, Colorado. Welcome to Heidi's Colorful Colorado. So happy to have you here today. Boy, did we strike gold today. We have Dr. Connie Price, who is the Chief Medical Officer at Denver Health. She is a busy, busy gal, just taking care of COVID and everything going on in Colorado around that front. But we are so blessed to have you here for just a few minutes to talk to us.
Thank you, Heidi. I'm glad to be here.
Wow, let's dig right in. First, though, I want to know, how did you end up in this field of study, infectious disease? I don't think many of us as little girls say, when I grow up, I want to be an infectious disease specialist.
Well, I don't think I did either. It really was something I decided later in college. I probably had, multiple majors before I really decided on medicine. And then within that, deciding on a specialty within internal medicine, it just kind of happened. I did a rotation in it and I loved how broad the specialty is. And I was just drawn to it and I still love it.
Tell us a little bit about your journey, like where you went to school and did your residency and all that good stuff.
Sure. Well, I did my medical school at Northwestern and then stayed on there for residency. And then I went for my infectious diseases training. I went to Bethesda to work at the NIH with Dr. Fauci. And so worked in his lab for a few years and got trained up in infectious diseases. Went back to Chicago and did some work in microbiology and got boarded in that field and then came out to Colorado.
Ah, that's fantastic. We are so blessed to have you here. And you also teach at the University of Colorado, correct?
I do, yes. I teach infectious diseases to our medical students and to our residents and fellows.
That's awesome, Dr. Price. Thank you for doing that. I mean, I think we have pretty amazing doctors and teachers, faculty at CU. It's been one of my favorite things about being a CU Regent is getting to know the medical side of the business and the institution. Personally, I had a brain tumor last August and had to have brain surgery by Dr. Lillihei. And so I got to know the ins and outs of CU very well from that perspective, but what a fantastic place it is.
It really is. And I'm so sorry you went through all that, but I can't think of a better place to be treated for what you had.
I agree. And Dr. Lillihei and the neurosurgery team at CU Anschutz is one of the best. And they just handled it beautifully. It wasn't cancerous, so I should be back on my path to health and back to my feisty self, as you can tell. So
I can tell. Congratulations.
Thank you. All right. So where are we at with this pandemic right now? And how's Colorado sitting?
Well, we're looking good. Our rates continue to go down and our hospitalizations also are going down. And we're seeing the effect of the vaccine, which is showing to be a very effective tool in fighting this pandemic. So for instance, our last data from Colorado show that of those who are hospitalized, those who get hospitalized, 95% of them haven't been vaccinated. So very few people who have been vaccinated actually are ending up getting COVID and needing to be hospitalized. So that's really good news.
That is good.
We're seeing some new strains circulating here as well, though, and we need to watch that. So the strain that you saw that we've been hearing about in India, that is starting to make its way into Colorado. But the good news is that our vaccines are effective against that strain. It's just that we may want to make sure that we're getting that second dose of either the Moderna or Pfizer, if that's the one we chose for getting vaccinated. So everything is looking good, but we're watching it closely.
That's great news. I'm sure we learned a lot about dealing with pandemics and how our public health system operates throughout this. What are some of the biggest lessons you think we've learned about dealing with this in the future?
Well, I think we have to take a better approach to that unknown that may be emerging. We have to just change our practices in healthcare. We may need to be more cautious of just even everyday infectious diseases to make sure we're not spreading them. I think we all have a heightened awareness of that. So in healthcare, we may be wearing masks more often and more routinely, not outside of healthcare, but when we see patients and we're encountering the unknown, I think this might be a practice that will stick for a long time. And certainly more respect for keeping people safe from transmission by being cautious about our airflow in our indoor areas, as well as making sure we're promoting vaccine when needed. And, when we feel unsafe, we always have our masks to go back on. And so I think there's lots that we've learned and lots to keep ourselves, that will allow us to keep ourselves healthier as a community.
I agree. I mean, my goodness, I think we all know how to wash our hands now really, really well.
Yeah, we're getting better at that.
I think, is it still the say the alphabet twice thing is how you teach the little kids about it?
We usually say sing happy birthday.
Sing happy birthday. Okay, I'll keep that in mind. What are you guys working on as far as kind of new ways or new innovative ways to deal with the public, not just on the pandemic, but around public health? Are there any real cool, innovative projects that have popped out of this or that are rising up because of COVID?
Well, I think we're learning more about transmission of just common everyday respiratory viruses that have been annoying to all of us since the beginning of time. And so I think there's more of a respect for the common, trying to prevent the common cold, flu prevention, all of these things. And so I think there's more research in the prevention of that. And we can all learn as a community how to keep ourselves healthier and not have to be, taken by these seasonal flu viruses and cold viruses every year by just some basic prevention measures. So we're learning more about that.
Speaking of which, so for someone who's not a medical professional, and some of my friends, we've talked about this, why was the flu rate so low? Was it just because we were being so careful, or is it because COVID and flu numbers got mixed up?
I don't think COVID and flu numbers got mixed up, but I do think some of the prevention measures for COVID certainly were effective against flu and other respiratory viruses. Often when we see something circulating in the community, there's usually something that dominates. And for whatever reason, the other viruses are kind of, lower levels while something else is circulating more prevalently. So it could be a couple of reasons, but certainly the prevention measures for COVID helped and kept the flu numbers down. And that's why I think so many of those practices will be here to stay, because who wants to get the flu or who wants to get a cold more often than they should?
That's right. That's right. Let's talk a little bit about women in the medical field. And I have a company called She Factor, which encourages young women in their 20s to create a life they love. And it's really about teaching them to be bold, fearless, go after their dreams, their passions. How did you do that and forge such an incredible career? Like, what do you think, what would you say to the 20-something-year-old woman who wants to get into the medical field? What advice do you have for her?
Well, first of all, thank you for doing that. What a great cause. And we need more of us to support each other and making sure that we're getting women out there, because it is important that we have that representation in medicine. And I think in this field, we have started to see more of an equal gender distribution among physicians. So that's good. We've had some headway toward that. But I would say, you just have to just go for it and don't second guess yourself. It's so easy. And I think it's as a woman to be insecure about your ability to compete in, a competitive field, but don't. Why? Just do it and do your best, keep your head down, keep working, and it'll all come to you. And then, get the support from others. Use the other women in the field like you who are uplifting us and helping get us out there, and use that support system. I think women are really good at taking care of each other.
I do too. And you hit on something that I think is really important, is that women tend to underestimate themselves. If you have a room full of men and women and you say, hey, does anybody want to do this really difficult job? Most of the guys are like, oh yeah, got it. I don't have the skills or experience, but I can handle it. And women are more like, well, do I need to go back to school? Do I need to take this course? Do I need to talk to this person, get mentored by this person? So what's the take there? Do you see that in medicine too?
Oh, absolutely. Absolutely. We are much more cautious and questioning of our own abilities. And, I think you have to just step back, take a deep breath and say, you know what, I got this.
Have you seen a larger interest from your students in infectious disease and your field now that this has all happened?
Well, yeah, there's actually some data showing that more people are becoming interested in this field. And before COVID, it was kind of, we weren't getting as many people interested. So there's something we're calling the Fauci effect. And, more people are interested and fascinated by it. And of course, I mean, if I were a young person who had lived through this, I would want to be part of the solution to prevent this from happening again, or doing even better at responding next time.
Yeah, I think we all had a bit of PTSD or anxiety when we saw the recent article about like the chicken, or there was some kind of bird flu or something in China, and everybody I know just kind of took a deep breath like, oh no, we can't do this again.
Oh yeah, we see this all the time in medicine and infectious diseases. It should be expected. This will happen again. These viruses tend to jump from other animals, whether it's a bat, an intermediary host from that bat, some other kind of animal. And so, we should plan that this can and will happen again, just because this is what viruses do. And we live in a world with increased travel and increased intersection with, other animals and humans together. And climate change, all of that plays into the ability of these new emerging infections to show up. So we need to plan on it.
One last question about this, and then I want to talk more about Colorado real quick. The speed at which the vaccination came about was crazy. I mean, like crazy cool in a good way. What happened? Like, how did that come together? And why can't we do that with other vaccinations or medications?
Well, I think part of the speed with this vaccine was a new technology that hadn't been used in vaccines before, using mRNA, which is the technology behind the Pfizer vaccine and the Moderna vaccine. And because of that, the production of the vaccine can be much faster than waiting to, for instance, grow cells in, like we do for influenza, grow cells in culture in using eggs, which we didn't do with this vaccine. So the technology allows it to be faster. And I think there was focus right away, to the credit of our scientific community, as soon as this emerged, and it was recognized that this was a pandemic that was here to stay until we got a vaccine. I think we rallied, and the scientific community got this done.
Well, we sure do appreciate that, especially as a mom of 4. I don't know if I could have managed another a year in the house with my kiddos. I love them to pieces, but that was a lot.
Yeah, it is a lot. It is.
So, Dr. Price, tell me a little bit about what you love about Colorado and why you live here.
Yeah, well, I came out here really for this job, but I stayed here because of Colorado. And, I love the sunshine. I love waking up on most days and it's sunny out. And I love spending time outside. And I think that's the answer you get from so many people. It's probably a little generic, but it is what I love about this state. And then the people are just very much live and let live. We take care of each other. There's a respect. I feel at home here.
That's a great answer. I love that. What's the most Colorado thing you've ever done?
Wow. Well, of course I ski most weekends, and that's very Colorado, but I think really the day I remember that might be the most Colorado thing I've done was going for a morning hike in the mountains, hitting the hot springs, and then getting down to Red Rocks to see the Fray at a concert. So, how
great
more
Colorado day.
Yeah, that is a Colorado day. Colorado band, Colorado venue. It's great.
I think you might win the award for the best Colorado day. Colorado day, that's pretty cool.
Yes.
Well, thank you so much, Dr. Price, for spending some time with us and talking to us about such a big issue in all of our lives right now. I really appreciate you taking that time to help us calm down a little bit, focus on the future, and understand what a day in your life is like, too.
Great. Thank you so much. I really enjoyed speaking to you, Heidi.
You too. Have a great Colorado day.
Thank you for joining us today on Heidi's Colorful Colorado. If you enjoyed this conversation, don't forget to rate, review, and subscribe. And definitely follow me on Instagram to keep up with my latest adventures. In the meantime, happy trails from me, Heidi Ganahl.